Hi, everyone. Welcome back to Living Well or Trying to. I'm your host, Janet. Today's episode is the second part of a conversation that I had with Dr. Mariza Snyder about all things perimenopause. If you haven't yet, you can go back to last week's episode to check out the first part of the conversation and then come back to listen to this. Or if you prefer, you can just jump right into this convo and then double back around and listen to part one, which released last week. Either way, I think you will learn so much. I definitely did. Whether you are a woman in her 30s, 40s, and 50s, where this is directly applicable to you, or you're a woman in her 20s who wants a little bit of insight into what's to come in the years ahead, or if you're a guy and you want to better understand what's happening with your partner or the other women in your life, I think she is such an incredible wealth of knowledge and just has such good energy, living proof that you can be perimenopausing and also living life to your fullest. So check this episode out and I hope you enjoy. Someone practice or implement when it comes to perimenopause?
Yes, I think the first thing is agency, right? Again, if we have a lot of practitioners, OBGYNs and primary doctors who don't really understand, I think it's up to only 30% of 31% of residency programs have menopause care built into them. A lot of doctors do not feel equipped to take care of women in perimenopause and menopause. And mind you, it is shifting. And hopefully it's shifting quickly. But we're still at a time where you go to your doctor, you talk about your symptoms, and you're still getting brushed off. And you walk out with more questions than you have answers, right? And that is the experience for millions of women. That is happening right now in doctors' offices today. Right. And so the first thing I think it's important is that we gain agency. And it's really about mindset as well. We get to decide. We get to say, you know what? This is not going to be my mama's. I'm not doing my mama's menopause, or I'm going to really take the reins here. I'm going to really step into the CEO hat and really own my health in a way that feels meaningful and true for me. And then it's gathering data and information. So one of the best ways we can do that, if you're still cycling and you have a cycle, is get clear on that monthly report card. Your menstrual cycle, your period can tell you so much about what's going on in your journey. And it's going to change throughout the entire cycle. It's not, initially you may notice period changes. It's what we've been taught to notice, or maybe PMS changes. But your follicular phase, that really great, vivacious, high energy, resilient phase, that's going to shift too. Okay. And you're going to notice, you're like, day 13, it doesn't feel the way that it used to feel. I'm feeling a bit flat. So you're going to notice the changes. But the more that you can track this information, it just gives you knowledge and power. Also allows you to advocate more for your health in your doctor's office visit, right? Number 2 is to track your symptoms. Really understand what is going on with my symptoms. And then ideally, if you can, a wearable of some kind. You know your heart rate variability, know your resting heart rate, know your body battery. What's your sleep score? What's your sleep consistency? What does that look like on a day-to-day basis? I think that information, especially if you've been taught to not really listen to your body, like so many of us have, that kind of information can really cue us in. If you wake up and your sleep wasn't great and you're like, man, honestly, I don't feel great. That makes a lot of sense. We can get more information. We can tease out information from there. So collecting that data and then knowing your labs. So I get that your doctors, we've got wide reference ranges, right? You could have very low vitamin D levels, but still be within the range. And your doctor tell you that
you're fine.
You're fine.
You're in the range.
And it's not necessarily fine, right? It's not optimal. Or your triglycerides could be almost to 150 milligrams per deciliter. Maybe they're 148 and you're told, well, you're still normal, but you're about to tip over the edge, right? As a big biomarker towards cardiometabolic risk. And so it's important, if we know some of these numbers and we know our data, we can actually kind of take course or we could be a part of the conversation. We can be a part of the team. So I think the first step is really having agency over your health. And the more information you can have about your body, because every single one of our journeys are going to be individual. Your perimenopause journey is going to be unique to to whatever you're coming in with. Your life circumstances, your health history, and even your family history, and also your goals, right? And so all of that, it's your life, you get to decide. Okay, based on this information, based on knowing my body, then these are the things I'm going to take into play. And so from all that info, I always tell women, get really clear on your non-negotiables. So I'm very clear on my non-negotiables.
What
And
are
we can
some
talk
ex
about those. Yeah.
Yeah, well, like, what are some examples? Like, you're saying that it depends on your goals.
Yeah.
So, for women that come and see you, what are some examples of, like, different goals that they're aiming towards?
Yeah, so a goal I had a recent patient, Susan, who came in who doesn't have grandchildren yet. She had children late as well, so she's still raising kids, but she's training for her future grandma self.
Oh, I
She
love
wants to be
that.
able to pick up her grandbaby at 4 years old or 5 years old off the floor when they're really sick
Yeah.
and not need help.
Mm.
She wants to be traveling. She wants to be climbing Machu Picchu with her
Yeah.
besties, when she's in her 60s. So she has these goals of like, okay, I'm not
That's
here yet because this is the journey that I'm in. I'm still mothering. I'm still very much in that kind of phase.
yeah.
But as I get older and I've got more free time, I've got more bandwidth, I've got more freedom. These are my goals. These are my objectives. I want to feel strong. I want to feel resilient. I want really optimal energy.
Mm.
And so she's really training for that.
Yeah,
In a phase where she's like, my energy's a little low. I'm
see.
still big time caretaking, and so she's trying to navigate that at the same time.
What are some of the ways that you're guiding her through
Yeah.
achieving that goal?
I would say number one, we are optimizing her blood sugar and her
Mm.
metabolism.
So
So
with, like,
yeah.
diet
Yeah,
and
diet. So I usually put a continuous glucose monitor
Mm.
on every one of my patients.
Yeah.
I don't have one on right now, but I had one on a couple weeks ago. And I often will wear one on vacation just to kind of keep me honest.
Yeah.
And it can track your blood glucose in real time. And that
Okay.
information is so invaluable because not only what you eat influences your blood glucose, and that is the ultimate energy currency, right? It
Mm.
gives you such a great sense of how our energy is being created and processed in the body. Right?
Yeah.
Metabolism is a lot of complexity with many processes, but that allow you and me to have this conversation, for me to
Yeah.
sit here and to show up in the world the way that I want. And so when we can track blood glucose, we can get a lot of information about
Mm.
how I'm eating. Is how do I feel on the back end of that? What's going on with my blood sugar, 2 hours after that meal? Or
Mm.
how is it impacting my sleep or vice versa? Did the 7 hours of sleep I got last night because I
Mm.
was jet lagged,
Yeah.
did that have an impact on my fasting glucose the next
Mm.
day when I woke up in the morning? Or did that stressful meeting, did it drive my a blood sugar spike?
Yeah, yeah.
Or did my eating at 7 p.m. versus 5:30 p.m., what was the difference that made in my blood glucose?
Wow.
And
It
so,
can really get very
yeah,
granular.
yeah, and
Yeah.
we can learn a lot about how our lifestyle impacts our energy. And so that
Mm.
was the first thing. We're looking at, okay, is there any lifestyle things that we're doing that
Yeah.
it's so unconscious to us, we don't know, that's actually impacting our cellular energy, our
Mm.
metabolic energy. And then sleep consistency. I
Mm.
think as lots of like moms going through perimenopause, we're working, we're caretaking, and then we
Yeah.
get the kids to bed, even the teenagers, and it's finally our time. And so I
Right, right.
find that we'll watch Netflix, we'll finish those emails, we'll
Mm.
finish our to-do list, and it kind of creeps into our later night. Or
Right.
maybe we have that glass of wine to wind down,
Mm.
and all of this kind of impacts our sleep. And so what does that sleep routine look like? Are you
Mm.
treating it like $1 million meeting?
Yeah.
What is your sleep consistency? So I'm very consistent. I go to bed, lights are off by 9:45 or 10, and I wake up at 6 a.m. And
Wow.
so I would say my sleep consistency percentage wise is about 84% because
Wow.
I'm consistently at the same time. And
Yeah.
what we know about sleep consistency alone is that it can significantly impact our health span. So
Mm.
these are those non-negotiables of like, is sleep going to make or break you tomorrow? Then what does that look like for you to make sure that you're getting the good sleep that you need?
Got it.
Yeah.
So, yeah, it sounds like it's like diet and sleep are the two that you've talked a lot about. But there's also like
Oh
exercise and
yeah.
working out.
Yeah.
And you did touch on this before that usually during this period, weight gain is something that women experience.
Yes.
Can you talk a little bit about what are suggestions you have to help manage that experience?
Yes, absolutely. Yeah. So now weight gain isn't an inevitability, but it
Mm.
does happen to a lot of us
Yeah.
for a number of reasons. One, we're losing muscle, we're losing strength. We are becoming a bit more insulin resistant because
Mm.
estrogen is dropping and declining. And life is very busy. So it may
Right.
be that, those big workouts, for whatever reason, we're not getting in.
Mm.
Or maybe we've been trained to just do cardio, bunny it out,
Right.
right? We just get on that elliptical, right? We've been taught that, from the 90s and early 2000s. And
Yeah, it's very
so we're not
true.
training. And so, yeah, things are shifting. We just know body composition alone is going to change due to hormones declining. And so I am a big fan of moving as much as possible throughout your day. So I always say, I know this is a big one, and I'm always curious of how controversial this is going to be because I believe that we need to build our life around movement. And
I like that.
yeah,
That's a personal, yeah, that's like a very high value for me as well, just because I notice my mental health is so different when I prioritize movement.
yeah, movement, the benefits of movement,
Yeah.
digestion support,
Yes.
sleep
Yeah. Yeah.
support, obviously metabolic support, blood glucose regulation.
Yeah.
But for me, it's stress. Managing
Yeah.
stress and feeling more regulated in my body. That's actually the number one reason why I walk in the morning. I want to set the tone of my day with regulation.
Yes.
And if I already know I have a full day that is like
Right.
full on and a 4-year-old who needs who knows what he needs from me, like if I can be centered and intentional about my day with that walk, it sets the tone for everything, how
Yeah.
I
Yeah.
show up. But also, I get 4,000 steps in that walk,
Wow.
and so
Yeah. Yeah.
I
Yeah.
would say, build your life around movement as much as possible. And I know that someone's listening to this and they're like, have you seen
It's
my
hard.
life?
Yeah.
Have you seen my list? And I'm talking squats. Like before I met up with you, I was in the bathroom doing squats. I did
I love
60
that.
squats before I came.
60?
Yeah,
Oh my gosh.
so I call it a buy-in.
A buy-in.
Where I wasn't in my heels yet. I was in
Yeah.
flip-flops.
Yeah.
And I usually walking into an interview or walking into a big meeting or
Yeah.
walking into dinner, I will knock out either 60 squats or 60 jump squats. Now I'm in a
Wow.
little dressed, I'm dressed up, so
Yeah.
I'm not doing jump squats before an interview, but I'll do squats. And not only does it get me more focused, it gives me more mental clarity, but it energizes me.
Yeah.
Also, today is one of those days where I'm on the road for 5 hours coming to LA.
Wow.
And
Yeah.
so I'm sitting. I'm mostly sedentary today. And
Right.
so
Right.
how I make up for that is I do exercise snacks, which are,
Exercise snacks.
yeah,
I
and
love
those
that.
it's just 1 to 5 minutes of kind of hit-based working out. It could be squats, jack squats, jumping jacks. It can be mountain climbers, push-ups. Grab some weights if you want. I walk
Yeah.
stairs with 20-pound weights up and down my stairs 3 or 5 times. It takes me 3 minutes. So I
Wow.
do
Yeah.
these mini snacks, like 3-minute snacks, probably 5 to 7 times a day, especially on the days that I'm not able to get to the gym. So I would
Okay.
say punctuate your day with exercise snacks, walking after meals, but also get in the gym and lift the weights.
Okay.
Progressive overload is really the intention. I know you hear a lot about lifting heavy. It doesn't have to be
Yeah.
heavy. Just be heavy enough for you to feel like you're doing something.
Got
And
it.
it doesn't have to be more than 20 minutes or even 15 minutes.
Yeah.
Sometimes I only have 15 minutes for a strength training workout and I just make it count. I
Mm.
really make it count.
Yeah.
So I get in there and I am going to go full out. And then I will punctuate the rest of my day with squats or push-ups or whatever I can do. And because I have a little 4-year-old who loves to do things with me,
Yeah.
he's always joining me. So
That's
we're
so
always
cute.
doing it together. Like we're doing, all types of movement and jumping and playing.
Yeah.
And so again, I still hit my 10 to 12,000 steps and I still rev up my heart rate multiple
Yeah.
times a day. And the research is clear that if we move more often throughout the day, it is more beneficial than that one workout and then us sitting all day long.
I like that. Thank you so much for reinforcing that. Because I think, like you mentioned, if you grew up in like the 90s or 2000s, we were always taught about just like hour-long cardio, right?
Yeah.
Even a
With
lot
your
of like,
glamour magazine or something,
yeah,
right? You would
right?
look at your magazine or listen to a
Yeah.
podcast or something.
Like,
Yeah.
I mean, all workout classes are still kind of like
Mhm.
structured that way. And something I have like just personally discovered, yeah, in the last like couple of years is that shorter workouts are actually like a lot more, I mean, they're just as like effective or efficient, and actually they can be more because you might be more likely to come back to them,
Yeah.
versus being so tired from just doing like an hour-long session. So
Totally. And you don't burn out. I
yeah,
have
yeah,
burned
yeah.
myself out so many times at the gym, working
Yeah,
out way
yeah.
too hard, doing too many 45-minute HIIT classes.
Yeah.
And then I've had to take major breaks,
Right.
month-long breaks to
Right,
to
right.
heal like crazy cortisol burnout. And
Yeah.
so I think with these little 15 minutes, 20 minutes, 10 minutes, 5 minutes,
Yeah.
it doesn't have to be this big thing.
Right.
And so again, you'll come back to it. You can carve that out.
Yeah.
I think in the time that we're deciding, we could have already knocked out,
Yeah. 3 minutes
yeah, 3
in the
minutes of
bathroom. You go for a
squats.
bathroom
Yeah,
break.
yeah,
Yeah.
yeah. I do it
Love
all the
that.
time because I was with my in-laws and my family we just came back from Kauai. And, it's not that I think anyone's judging me if I like after
Yeah.
dinner start busting out my
Yeah.
squats or like my jump squats. But I usually go in a corner. Even when we were flying home, I went to the back of the plane
Oh,
3
yeah.
times and did 3 sets of basically did 60 jump squats, 3 times
Wow.
on a 4-hour flight, whatever that was.
Yeah,
And
yeah.
it feels good in my body to not be
Yeah.
sitting, but
Yes, yeah.
also it helps support my metabolism, my blood
Yeah.
glucose. It's just a win. And you can go to the back of the plane. No
Yeah,
one needs
yeah.
to see you do it. That you can always hide in a corner and knock
Yeah,
out
yeah,
your
yeah.
exercise snacks.
I love that. Yeah. That's very much like incorporating movement as just becomes habitual and
Yes.
it's frequently throughout the day, but it doesn't have to be intense and it doesn't have to be super hardcore.
Yeah, no,
Yeah.
and there's so many benefits to it.
Yeah.
So many
Love
benefits.
that.
Yeah.
Can you talk a little bit about birth control
Yeah.
and its relationship with perimenopause?
Absolutely. I would say up until recently, we didn't really have a treatment protocol for perimenopause.
Right.
We really didn't acknowledge it, up until about 10 years ago.
Yeah.
And all we had, as a prescriber is birth control. It's kind of what
Mm.
prescribers have always been told, if a woman's got acne, birth control,
Mm.
if she's got an irregular cycle, birth control,
Is the
polycystic
go-to
ovarian
remedy for
syndrome,
everything. Yeah.
yeah, that's just the go-to thing because it regulates your cycle. But I just want women to know it's important that we're informed that it's not regulating your cycle.
Mm.
It's shutting it down. It's shutting it off. It's shutting off ovulation for the
Mm.
most part, like birth control pills or even the Mirena IUD, which is a
Mm.
progestin-based IUD, a
Yeah.
fake progesterone.
Mm.
Some women may occasionally ovulate, but for the most part, the intention is to not get pregnant, right? This is
Mm.
contraception.
Right, right.
And the way that contraception works is we shut off hormones and we shut off ovulation.
Mm.
And yes, birth control can be very supportive in perimenopause for a couple of things. Really uncontrolled bleeding and flooding,
Mm.
and also really severe perimenopause or PMS symptoms.
I
You know,
see.
but otherwise, it's really not the best go-to
Mm.
for managing symptoms. One, it's synthetic hormones, so they're not real hormones or
Mm.
bioidentical hormones. And synthetic hormones don't impact the entire body the way that our real hormones do,
Mm.
especially the brain. A progestin or progestogen, depending on what you want to call it, depends on what country where you're at. But
Mm.
I call it a progestin for the U.S. Isn't going to cross the blood-brain barrier. So if a
Mhm.
woman comes into my practice and she has brain fog and sleep issues and mood swings and rage and she feels low stress tolerance, she doesn't feel like herself anymore.
Mm.
Giving her a progestin IUD isn't going to impact the
Mm.
brain in a positive way.
I see, I
It's not
see.
going to have it's not going to be like taking bioidentical progesterone or
Mm.
bioidentical estradiol, right? It's just not going to have the same impact. And when estrogen and progesterone are master regulators of the brain, what women really do deserve are solutions that are going to actually have an impact on the brain itself. And so again, it's always about working with your provider about what's going to work for you based
Mm.
on your symptoms. But it's also important that women have informed consent, that they
Mm.
understand what they're signing up for. That when they go on a progestin only pill or a combination pill, that it's really shutting down everything.
Mm.
And that doesn't necessarily mitigate the insulin resistance, the body composition changes, the loss of bone, or
Mm.
the changes in the brain, right? We're talking about a full body remodel. And we really need a comprehensive approach than just birth control.
How about for someone who is on birth control or who has an IUD?
Mhm.
Do you see that that helps or does that affect how their perimenopause presents?
It does. It does.
Mm.
It can make it harder to
To
know that
know.
you're in
Yeah,
perimenopause,
yeah.
absolutely. And that's really the job of the pill in a way. It's kind of
Right,
like
right.
you're masking the symptoms. That's when you're on, if you're recommended the pill in your 20s or your 30s
Mm.
for symptomology, irregular cycles or painful periods, the same thing. We're kind of
Mm.
masking symptoms. We're not addressing the root cause of the situation. Now, the root cause of perimenopause is irregular, erratic, declining hormones. And so
Mm.
for some women, turning that whole system off, it kind of feels like a win. So they're
Mm.
not experiencing a lot of those symptoms. But again, the brain related symptoms, the bone loss, the silent changes, kind of the
Mm.
bigger physiological changes aren't going to stop just
Mm.
because you're on the pill.
So when you have patients that come into you who are on birth control or do have an IUD, do you generally suggest that they go off of that or have it removed
I
to
think
kind of
what I normally would do is I'll ask, kind of the purpose of why, because some
Mm.
women are on it for contraception,
Right,
right?
right.
But if they're struggling with other symptoms or they're not really happy with it or they're not sure what to do, I think my intention is always to educate and offer the options,
Mm.
and offer what's available. And then they get it aside. I think a lot of women who have been on the pill unknowingly or on the Mirena IUD for
Yeah.
10, 15 years kind of don't know anything different. And just
Right,
like,
right.
I kind of want to know what's going on with my body. I kind of want to have better agency over it. They may decide to come off of that and then
Mm.
kind of get their equilibrium, get their homeostasis, because it takes a couple of months after you've been on a medication like that to
Right,
get
right.
back to homeostasis and then go from there. What kind of lifestyle interventions is hormone replacement therapy necessary as
Mm.
well? And is supplementation going to be of benefit too?
Can you talk a little bit about hormone replacement therapy?
Yeah.
Because I've heard about that a lot, but I don't really know what it is or how it works.
Yeah, absolutely. I'm on all the hormones
Oh, okay.
myself. Yeah.
Yeah.
Because hormonal birth control, we just never got along. I never
Yeah.
did well with synthetic hormones
Mhm.
personally. I tried them a couple of times and my body was like, no,
Yeah.
this is a full body no. And so when I started experiencing changes, I was like, okay, let's take a look, and HRT, hormone replacement therapy, which is basically it's hormones. It's
Yeah.
in a lab, hormones that are made in the lab that are identical to the hormones that you make in your body. And
Mm.
basically for women in perimenopause, they're filling in the gaps. Right? As we are beginning to irregularly have these hormones bind to receptor sites, that's when the symptoms begin to arise. And
Mm.
so we can fill those gaps potentially, depending on the woman, with hormone replacement therapy if
Mm.
they're a candidate for it, which so many women are. But yeah, they're just hormones that are like ours, exactly like ours, that we can take to kind of mitigate symptoms, but also to future proof our health. Right? If
Mm.
we know that a decline in estrogen is going to lead to more cardiometabolic risk, or more dementia risk, or
Mm.
more bone loss, or muscle loss, or we know it's going to lead to other diseases of frailty or general urinary symptoms, right?
Mm.
We vaginal dryness and atrophy and UTIs and low libido. All of this is being impacted by a decline in estradiol.
Mm.
If we can bring estradiol back in as a medication intervention, we
Mm.
can mitigate a lot of those things preventatively so that they don't start to play out decades out in the
I
future.
see. And are these generally like supplements that you're taking like in the form of a pill or how are they administered?
Yeah, they're so administered transdermally, so creams or
Mm.
gels. So
Okay.
that estradiol is usually administered transdermally.
Okay.
It can also be administered in a pill form, but
Mm.
we know that taking estradiol orally, it has to go through the first pass of our liver and our gut,
Mm.
and it increases our potential risk for clotting and stroke. So we
Mm.
tend to,
As
especially
a
if women have
cream,
a
it's
history
better.
of cardiovascular disease or the family history of cardiovascular disease, we know that transdermal application of estrogen is a safer option. It's just
Okay.
as effective, and it doesn't have to go through the first pass of the gut and liver.
Mm.
Yeah.
Okay.
So, and then progesterone is usually done oral. So it is done as a pill.
Mm.
So it's
Okay.
called oral micronized progesterone. And when women are cycling still in perimenopause, we usually cycle that
Mm.
oral micronized progesterone. So for
I
me,
see.
I take it after I ovulate all the
Mm.
way for like 13 days, and then my period starts. So I
Oh,
cycle
I see.
progesterone into my cycle so that it's replicating a cycle. Yeah.
Mm. Okay.
And then testosterone, again, not FDA approved for women,
Yeah.
but we can still get it. It's compounded off label for libido, exercise recovery, cognition. Technically, it's only off label recommendation for low libido right
I
now.
see. I see.
But testosterone is typically done with a cream
Mm.
or gel.
What about testosterone pellets?
Yes. I was going to say also pellets and
Yeah.
troches, but I don't typically recommend those.
Oh, why is
Yeah.
that?
So troches, we find that a lot of it just doesn't get into the system, so it's not
Mm.
as systemic. So the
Okay.
results, one, they're short lived, and they're not as robust as what
I
we would
see.
love. And then with a pellet, it's really hard to regulate the dosage and concentration.
Oh,
And for women, we want to keep, like all hormones, we want that Goldilocks spot.
the
But
perfect
often what
amount.
happens with women is we accidentally overdose them. And once they're inserted right here,
Mm.
kind of lower back, kind of at the buttocks, we can't take them out. And they're in there for 6 months. So you
Mm.
could have unregulated, extremely high levels of testosterone for 6 months, and there is nothing that a provider can do about it.
Mm.
And so I
Okay.
usually recommend, again, I think it's important that this is not a one size fits all when
Yeah.
it
Yeah.
comes to hormone replacement therapy or any hormones. for that matter, thyroid hormone, testosterone, estrogen, progesterone. And so it's really about you're kind of working with a provider to really find the right dose.
Right.
And in perimenopause, the one thing I can guarantee, I think for women in general, the one thing I can always guarantee is that we're constantly changing. But in perimenopause, we are 100% changing.
Multiple
There's
things are changing all
multiple
the time.
phases happening, multiple changes. And so hormones are going to be drastically changing throughout the journey. And because of that, your HRT protocol or your hormone protocol is going to need to adjust as well. And so we're working with HRT that is easy to dose and change as you are changing. Yeah.
So can we talk a little bit about what the different phases of perimenopause are?
Yeah, absolutely. So officially, technically, there's two, but I'm just gonna call three right now. So the first of the three phases is late reproductive. So it's going to be mid 30s to late 30s. Again, often for many of us, especially living in this modern day world, I always say that living in this modern day world is not necessarily conducive to happy hormones. It's just a lot. The chemicals, the stressors, just lifestyle, a lot of things are playing a role in really messing with our hormones. And so I do see more often than not than ever before, I have women coming into my practice with progesterone levels that are much lower than I would expect in like mid 30s into late 30s.
Oh, wow.
And to the point where they're needing progesterone support, bringing in oral micronized progesterone. And so again, what women will notice is those brain-related symptoms, the low stress tolerance, the more PMS symptoms, things are just exacerbated. Like maybe you had like not so great sleep, but now it feels worse.
Right.
Maybe stress was something you could manage, but now it feels a bit unmanageable. So I'll start to notice a lot of those brain-related. Women, again, are not feeling as stable, as sharp, and as having it all put together the way that they used to, even 5 days ago or 5 months ago, you know, depending on where you're at in your cycle. Like still feel good in the follicular phase, but tanks in the luteal phase, right? Because progesterone's tanking.
Right.
So that's usually late reproductive, where we're seeing hormone changes, often progesterone. Cortisol could be acting up as well. We could be seeing, deregulated cortisol, more increased stress response system, where we're just feeling more stress, feeling more fight or flight. Maybe a little bit of insulin resistance, so body composition changes, but not a lot. But just noticing, like, I can't lose the weight the way that I used to on my standard diet. Right? I can't just do like a 7-day cleanse and just like be back to the races. And then we have early perimenopause. This again is early 40s to mid 40s. This is that kind of defining moment at 42 or 43 years old where you're like, what's happening?
Very pronounced
The moods are very noticeable. The rage is noticeable. Family members are like, okay, what's going on? Like you're noticing that you're having to really focus to be productive at work. Body compositions are definitely changing. You're not recovering from your workouts the way that you used to. Maybe you're noticing aches and pains and more inflammation in your body. Your gut even your gut and your digestion's changing. Like you're starting to notice more things are adding up that never before. You can't really brush this away anymore. You're going to your doctor, you're asking for labs. You're like, is this perimenopause? Because it's feeling like perimenopause. And then we get to late perimenopause. Now, the distinction between late and early is early, you're still cycling. Now, it's not saying that your cycle is the same as when you were 35 or 32 years old, but you're still cycling. And so that's why we often ignore women. We're like, well, you're still cycling. You're fine, right? And you're like, but I'm not fine. Like something isn't okay here. Like I'm not getting that day 12 before ovulation boost. Like it's not happening, And so, but you're still cycling. You're still running maybe a 26-day cycle or a 25-day cycle, but things are relatively consistent. Late perimenopause, how we define that is periods are not consistent anymore. Now you're skipping up to 60 days. You kind of don't know what is happening. Are you going to get a consistent period or a cycle this month or not? And so that's where we are. We know that we're 1 to 4 years from menopause at that point. So this is usually, I would say, as early as mid 40s, but usually late 40s to early 50s. I would say most women begin to notice probably 46, 47, 48 is when they're like, okay, my period, it hasn't come. What's going on? And then it didn't come again. So that's where we're in late perimenopause. And we're basically, periods are becoming more and more infrequent with maybe spotting bleeding or super heavy bleeding. This is where the night sweats and the hot flashes and the vaginal dryness come in, the really bad sleep, maybe the worst anxiety and depression. This is where we really feel like we're in the eye of the storm.
I
Like
see.
basically estrogen is bottoming out. We're
Right.
in the decline at that point, and we are noticing the effects of that. And it's very acute. And then 12 months of not having a cycle or a period consecutively is officially menopause. And that's when we know we've officially hit menopause. But the thing about that, what bothers me so much about it, one, I think it's important that we know that date, but I just want women to know, I think we've been educated or told that once we get to that defining moment, all of the chaos of perimenopause is just going to go away.
Yeah.
Poof, just gone. That is just not true.
Yeah.
This is a continuum. There's no magic moment or magic day where we are in the clear.
Yeah.
If anything, the research and the stats in terms of our health outcomes show a very different story. And so I just want women to know, although, yes, it's important that we know that day, it's also important to know that you have been in this continuum for a long time and that you are going to continue on.
Right.
And that the more that we can do to be proactive about our health, we don't take the default path. We take I am taking charge of my health. Yeah, I'm very proactive. That path, that's how we set ourselves up for success down the road.
That is so empowering.
Yeah.
Thank you. Can we talk about for each of those different stages what your recommendations are for someone who is maybe in their mid to late 30s? What are some suggestions for how they should be either lifestyle habits or things to kind of like set them up better for those later stages? And then once they enter in their like early 40s, mid 40s, how should those habits change?
Yeah, such a great question. I love this. I think that first thing I talked about earlier is really knowing your numbers and knowing your cycle. So the more information you can gather on yourself to notice those subtle changes, you get to stay in front of it. You're like, oh, something's shifting here.
Yeah.
Let me pay attention to this. Let me get curious about this. So I think it's important to know your body, know your cycle, know that report card, and know your numbers. I recommend annual labs every wellness check. Like, so that you have a timeline of your labs so that if something starts to go out of range, you'll know, oh, when I was 40, that wasn't out of range. Now at 43, it's moving out of range. That is not my normal.
Right.
So it's important because the doctor could be like, oh, that's normal. And you're like, that is not normal for me.
Yeah.
It was optimal back,
Right.
2 years ago. I want to understand what's happening. So that's important. Then also, I think it's important to get clear on who you want to become. How you want to feel. I think one of the most important questions you can ask yourself is, what would I love? How do I want to feel 30, 90 days out or even a year out? And get clear on who she is, who you're going to become, how you want to be living your life. And then get clear on your non-negotiables, mainly around your nutrition. Like, are you balancing your blood sugar? Are you getting enough protein to support your body, particularly your muscles? Are you moving in a way that feels really good to you, that's helping to support your body and your muscles and your bones? Are you sleeping? Are you honoring your sleep routine and your circadian rhythm? And also, are you honoring you? Are you prioritizing you when the world is telling you to prioritize everything and everyone else?
Yeah.
And what does that prioritization look like? So those would be the first kind of benchmark pieces I would be looking at. Is like, what is mission critical for me? What helps me to feel most alive? And then as you step into your mid to late 40s, I would be thinking, okay, if lifestyle isn't mitigating this, then what about HRT? Can that help to mitigate? Can supplementation support me? Can hormone replacement therapy support me? What are some of the tools, medications, and supplementation can I bring in to support? And do I need to make any changes to my lifestyle? What was working for me at 37, man, it isn't working for me anymore. Yeah. So just really attuning to your body and knowing what's working for you and paying enough attention that when it shifts, you are pivoting along with it.
I really like that. Yeah. I think there's so much out there now with new different like Aura rings and watches and devices. And I was like, okay, these are like fun tech gadgets, but really there's a huge, strong purpose to that, which is like you're saying, it helps you and it empowers you to better track and know your body. So if I didn't have a reason to to want to invest before, this is definitely a really strong incentive. And yeah, I think this is amazing. Thank you so much for that information, Dr. Mariza Snyder. Do you want to talk a little bit about your book now? I'd love to learn more about what it is about, what you're hoping to accomplish with it, and where our listeners can either find it or help support you.
Yeah, I would say this is one of the first books on perimenopause ever
Amazing.
written.
Yeah.
And it's a rallying cry for the millions of women that are going through it. It is really a movement where we are clear that we deserve to feel good.
Yeah.
We deserve to feel heard, and we deserve to feel amazing moving into the next phase of our life. And so it's a first part of the book is really understanding, am I in perimenopause? What is this? What's happening with my body so that we really fully understand? And then the second part is the pillars. A lot of what we talked about today, the nutrition, balancing blood glucose, boosting our cellular energy, movement, circadian rhythm, but building community and creating more peace in our body. And then I think a big part of all of this is the mindset. Who am I becoming in the second half of my life? What is she tolerating? What is she saying no to? What is she a full body yes to? This is a time in our life where when we only have so much energy capacity, we get to be discerning about what we want moving forward. We get to let go of the things that haven't been serving us, that we don't even know why we said yes to it, right? And we get to decide what we want to bring into the second half of our life in terms of our health, our work, our passions, the things that we love. And so I think this is such a beautiful opportunity to get discerning about what we love, where everything is up for review, and get to decide. Like, decide that I am worthy of healing. Decide that I am worthy of feeling good. Decide that I'm going to feel good in my 70s and 80s, and that I'm going to have the freedom to do what I want. That's what this book is laying the groundwork for. And then I have all the recipes, a 5-week plan, workout videos, workouts. I mean, name it. I am setting you up to win, not only to feel amazing today, but in 10, 20, 40 years down the road. That is my intention, because women you do not deserve to suffer needlessly, ever.
That was so beautifully said. Thank you so much. And you actually have a very special offer for our listeners. I think we have a link in the description for a bonus page with a free perimenopause toolkit that's at a $500 value. So this will be amazing. Thank you so much. Thank you, Dr. Snyder, for being on this show. I love this conversation. I feel so much more educated, and I know that others out there do as well.
Thank you so much.
Thank you so much for tuning into this episode of Living Well or Trying to. If you don't already, please follow or subscribe on Spotify, Apple Podcasts, YouTube, wherever it is that you get your podcasts. It means so much to me that my new episodes will just pop up in your feed. And if you like what you're hearing and seeing, please leave a rating and review. It means so much for a small content creator like myself in this world that is so saturated now to be able to have some feedback from all of you. As always, I so appreciate you. Thank you for lending me your ears, your eyes, your presence, and your attention, especially in today's world when there are so many other places that you could be giving it to. Thank you so much from the bottom of my heart, and I hope to catch you on another episode.